All right, let's go ahead and get started. Good morning, everyone, and thanks for attending. My name is Cody Smith, and I'm a senior policy advocate at the Iowa Environmental Council. The Iowa Environmental Council is a statewide nonprofit organization that strives to build a healthy, just environment for all Iowans. We've been working since 1995 to create a future where our state is leading the nation in building an environment that is safe for Iowans to live, work, and raise their families. Today, on World Asthma Day, we're releasing our new report, Coal and Siouxland, MidAmerican Energy's Legacy of Air Pollution and Health Impacts, which we wrote in partnership with the American Lung Association, Physicians for Social Responsibility, the Winnebago Tribe of Nebraska's Winnebago Comprehensive Healthcare System, and others. The findings presented in this study paint a troubling picture of how coal plants in Northwest Iowa, owned and operated by MidAmerican Energy, are polluting the air of our communities and disproportionately harming the most vulnerable residents in our state. Pollution from coal plants has become normalized in Iowa, and it's a disservice to all of us. This type of pollution is unique in many ways because those that suffer the most can't see it, yet many of them feel it and are left to deal with its serious health consequences. We began looking at these issues to raise awareness among Iowans and end the silent suffering of our state's most vulnerable residents. We have the nation's 15th largest fleet of coal-fired power plants, and its impact is felt every day, especially in low-income areas and communities of color. MidAmerican Energy's coal plants in Siouxland have been associated with at least 1,400 premature deaths between 1999 and 2020, and they must stop ignoring this problem. Our report highlights that Woodbury County has the state's highest rates of asthma in adults, and that the rate of asthma-related visits to the emergency room outpaces the statewide average. Simultaneously, Woodbury County also has the most coal plants of any county in the state. Even if MidAmerican Energy attempts to deny that their pollution causes asthma and these other harmful diseases, such as COPD and coronary heart disease, there is absolutely no question that their pollution makes these conditions worse and harder to live with. Siouxland deserves better. Given the prevailing wind direction and speed, we also know that the pollution from these plants does not stay in Iowa. We found concerning health statistics from neighboring Nebraska and South Dakota. For example, Union County, South Dakota's lung cancer rate is nearly 14% higher than the state's average. We also found evidence of the disproportionate impact that coal plant pollution can have on existing chronic diseases, particularly among historically disadvantaged populations in Nebraska. For example, while Native Americans only make up 1.6% of Nebraska's total statewide population, they accounted for 13.6% of the state's COPD cases between 2016 and 2020. The reality is undeniable. MidAmerican Energy Company owns and operates the George Neal South and George Neal North coal plants in Siouxland, pictured behind each of the speakers today, and they're responsible for the pollution that their plants produce. We hope that our report is a wake-up call for the leadership of MidAmerican Energy Company and that they act swiftly to become the responsible corporate neighbor they claim to be. You can find the full report and read it in its entirety at iaenvironment.org/coal and Siouxland. Thank you for joining again today, and I'm going to introduce the next speaker, Kadeen Stein from Moms Clean Air Force.
I'm Kadeen Stein, and I'm Iowa coordinator for a national organization called Moms Clean Air Force. We have over 1.5 million members, primarily caretakers of all kinds, and we fight to protect our children and other vulnerable individuals from air pollution, from the climate crisis, and from environmental injustice. And because of our limited time, I'd like to just focus on children in my remarks. The children in Woodbury County and in the areas near Neal Smith plants are uniquely vulnerable to air pollution coming from these plants and any source of industrial pollution, but particularly the pernicious components of what comes out of coal plants affects children disproportionately. And there are some simple physiological reasons behind it. Children breathe faster than adults, and they spend more time outdoors, they exercise more, so the intensity with which they breathe, as they breathe faster than adults, makes them disproportionately affected by anything that adults breathe in. And we are simply not doing well by our children, and the data reflect this. The other thing about children is that these effects of the coal plants start before they're even born. In other words, there's a very, very clear correlation between the pollution from coal plants and other industrial polluters and adverse birth outcomes. So, low birth weight, premature births, or even stillbirths. And these things predispose children to never develop their true potential. And so the children, especially of color in the area, as Cody pointed out, have been at a disadvantage for as long as these plants have been in operation. And some people will say, well, asthma is a biological condition. Too bad for those with asthma. A lot of the cases of asthma, the majority have a genetic component, but not all of them. And the asthma cases are increasing, simply produced by pollution and allergens. If the asthma attacks are caused by fossil fuel pollution of one kind or another, then it's not a biological problem. It is a fossil fuel problem that is human created by humans. The other component in all of this is how fossil fuels, and in particular coal plants, have contributed to the buildup of CO2, and hence how they have contributed to the climate crisis. When you combine long and extreme periods of heat with pollution components, then everything gets magnified. So now we're talking about 2 levels, 3 levels. Communities of color disproportionately affected, inhaling continuously, day in and day out, in the places where they live, where they work, where they learn, all these pollution components. And then you add heat to that. And then the triple whammy effect on communities nearby is simply unspeakable. People are very concerned about the economic costs. Let's talk about the economic costs of having a whole generation of children grow up without ever reaching their potential. And it's not just the children, it's the parents staying up at night. It's the parents waking up, having to take them to the hospital, and what that does to the capacity of a community to function and of people to reach their potential. And then my last comment is, asthma is a killer. It's not just a nasty disease. And nationwide, if you're a person of color, then you're 5 times more likely than a white person, especially children, to develop asthma attacks, and 8 times more likely to die. That's unacceptable. So let's stop thinking about people as statistics. Let's start thinking about people as human beings, like everybody, who have a right to grow up healthy and to develop their full potential in society.
I'd like to introduce our next speaker, John Rakow from the Physicians for Social Responsibility.
Good morning. Well, the ongoing health injury to people locally around Sioux City and further downwind is one of the reasons I think that this new report is so important, and it builds a good basis on a overall health, population health basis for the early and final shuttering of the Sioux City coal plant. 50 years ago, when the George Neal plant was opened, there were really few economic alternatives to using coal to generate electricity. And the health and environmental injuries due to coal burning were, I think, really poorly recognized 50 years ago. And how times have changed in the last 50 years. The health and environmental consequences of coal burning are now well recognized. This report dramatically corrects this lack of recognition. And in the last 50 years, safer, healthier, and cheaper electricity generation technology has rapidly advanced. Also, in the last 15 to 20 years, remarkable progress has been made in reducing the number of coal burning utilities in Iowa. I think Iowans really want clean air. And currently, much less expensive and clean wind-generated electricity supplies 60% of Iowa's total energy production, And now Iowa is a net exporter of electricity. Also, solar photovoltaic generation costs have plummeted steadily. And currently, solar electricity generation is the cheapest way to set up and maintain large electricity generation. And solar is likely to be actually likely to burgeon because of the bottoming costs of it. And finally, the EPA has just issued final rules that are set to limit harmful air toxic pollutants and carbon dioxide from fossil fuel power plants and in their air emissions. The new rules also provide for the long-awaited crackdown on the management of extremely toxic coal ash waste. This is primarily a water pollutant for groundwater and surface waters. And these new rules will likely, I think, force the George Neal plant to be phased out, not by the planned 2050, but by, according to the rules, 2032, and possibly sooner. Thank you.
Thank you, John. I'd like to introduce our last speaker, Josh Mandelbaum, Senior Attorney at the Environmental Law and Policy Center. Josh?
Hello, I'm Josh Mandelbaum. I'm a staff attorney with the Environmental Law and Policy Center, and it's great to be joining you today. The work that the Iowa Environmental Council and partners did to highlight the health impacts of the George Neal plants is really important. We know that these plants are massive carbon polluters. They're impacting climate, but on a local level, they are having an immediate and significant impact on the health of the communities surrounding these plants. And this is made even more urgent or more significant by the fact that we've got better alternatives. We've spent a lot of time working to get MidAmerican to retire these plants, not even talking about the health impacts, just talking about the economic impacts. The fact that these plants are uneconomic, they are costing the same people that they are harming their health, they're harming their pocketbooks too, because these plants are uneconomic to run, and we've got better alternatives to reliably provide energy today. And that's wind, that's solar, that's implementing energy efficiency, demand-side resources, battery storage. MidAmerican simply has to want to work with us to make things better. The pathway is very clearly there. If we plan, if we act, we can retire these coal plants today and provide a cleaner, more economic source of energy that will benefit the community in multiple ways. It's beyond time to act, and this report just highlights the consequence of inaction. Every day that we do not act, every day that we don't do what we know is better, what MidAmerican knows is better. Their own internal studies show that these plants are uneconomic. So every day that we don't act and take the right path from an economic perspective, we are harming the community, we're hurting their health, and there is no reason for this inaction. We have the ability to make things better, to provide more affordable energy, to transition without compromising reliability, without compromising public health, without compromising people's pocketbooks. MidAmerican can act, they must act. This report highlights exactly why it's so important to do so.
Thank you, Josh. As was mentioned by everybody on the call today, we hope that this begins a conversation with MidAmerican Energy about what can come next for the communities in Siouxland and how we can work together to protect reliable service of electricity, but also protect public health at the same time. There are many options moving forward, and we look forward to engaging with them and call on them to stop ignoring these serious negative health outcomes from the George Neal plants near Sioux City. With that concludes our scripted part of the press conference here. I would like to just invite folks to submit any questions they have in the Q&A, and we'll hang around for just a few minutes to answer those if they come through. Thank you. Thank you for your question, Sheila. The 1,400 premature deaths was attributed to the 2 plants, and that includes individual emissions from the plants, particularly, specifically particulate matter pollution. This was a peer-reviewed study that was funded by the National Institutes of Health, and it does mention the statewide totals, which are a little bit lower. I'm happy to share those numbers with you. They're also in the report. And then these deaths also incorporate premature deaths from other states, including Illinois, Minnesota, South Dakota, and Nebraska.
I'd just like to make a quick comment about particulate matter. Again, to make it really, really visual, particulate matter, or PM 2.5, are particles that we can't see. They're 80 times smaller in diameter than a human hair. And these are around coal plants every day. Neil Smith and every day, the 2 plants are putting out particulate matter. People are inhaling them, and then they go in, for example, in the case of pregnant people, they enter the bloodstream because these particulates are so small. They enter the bloodstream, and again, before children are born, they're already born burdened, and these particulate matter particles cause lung problems, heart problems, and so that explains why there's such a correlation between particulate matter and death rates. But again, important to note that children before they're born are exposed to these particulate matter particles.
Thank you, Karine. And Sheila, I'm putting the numbers here in the chat for you, so you have them on a local basis for the region in Siouxland. But the numbers, just to reiterate them, are 92 Iowans, 61 Nebraskans, and 12 South Dakotans between that time frame of 1999 to 2020. I see your comment here about MidAmerican told me they plan to retire all 5 coal plants in Iowa by 2050. Have you heard any update on the timeline for the plants in Woodbury County? Other than a filing that was shared with their shareholders, MidAmerican has not committed to a timeline that anybody is aware of. That 2050 number was a statement that they shared with their shareholders in regard to alignment with the Paris Climate Accords. And that is something that's completely optional. They haven't made a firm commitment on closing these plants sooner. They have not made the case for keeping them open either. When you talk to them, they will speak of reliability. They will talk about reliable service to their customers. But as we've pointed out in this report, Woodbury County in particular is uniquely vulnerable to the pollution impacts of these plants. It has the highest rate of asthma in the state. It also has the highest number of coal plants with these 2. And we have not heard any realistic timeline or plan from MidAmerican Energy about how they plan to retire these plants and or addressing these serious health impacts. And in addition, the filing that we're aware of does say 2049, which is, semantic difference because it's not a real commitment. It's not a serious strategy. And they like to rely on this when they're asked questions about the serious impacts that these plants provide. But we're hoping that this report will serve as a wake-up call for them. Even if MidAmerican wants to push back that their coal plants do not cause these serious illnesses, such as asthma, COPD, coronary heart disease, or lung cancer, there is absolutely no doubt that their plants make living with those conditions harder and make those health outcomes worse for the residents of Siouxland.
I would note, Cody is absolutely right that there has not been any commitment from MidAmerican on any earlier dates. They occasionally say publicly that that maybe they will retire at the end of depreciable life, which is earlier than 2049 for these plants. But we have not seen the type of actions that you would need to see to plan and implement that retirement. We think that these plants are uneconomic today and could be retired as soon as they go through the planning process. So there's a lot of room for MidAmerican to do better and to speed these plant retirements up. They just have to be willing partners and willing to do what is best for their ratepayers and customers, what is best for the health of the surrounding community, what is best for the long-term transition to the clean energy economy.
If there are further questions, feel free to put those in the chat, and we can answer those again. Thank you, Sheila, for your questions and for attending today. I will note for both the panelists and those on the call, we are also hosting a media availability at 1 p.m. today, where some of us will be available to answer questions. And so feel free to tune into that if you'd like to ask additional questions about the report. We're happy to dive in on some of the specifics as we've done here today. Other than that, I would like to thank our panelists for their participation in today's press conference, as well as their partnership on exploring the details that are presented in this report. We again hope that this report serves as a wake-up call for MidAmerican Energy to serve as the responsible corporate neighbor that they like to claim to be. And we believe that the people of Woodbury County, the people of Siouxland more generally, deserve to breathe clean air that doesn't make them sick, and to drink clean water that also does not make them sick. So thank you again for attending. And with that, we're going to go ahead and close out the press conference. Thanks.